Hi, Jay.
Hi, I know it's early.
Oh, that's fine. I'm going to be setting up the room as people come in, so it's perfect. Jay, do you mind uploading a picture or an avatar?
I have one.
Okay, let's
You don't see it?
see.
I see it on the screen. I mean, I'm happy to upload something different.
No, wait, hold on. I'm looking for, okay. You get to see some of the behind the scenes here.
I just wanted to make sure I could connect.
Yeah, no, I appreciate that. Okay. Huh. So in the city, this is, can you see my screen?
Yeah.
So this is what I have for you. Like, so, and
If you look at the participants, you can see my avatar.
Participants in the Zoom call?
Yeah.
Oh, excellent. Would you mind going into the city itself? So you could go
Into
to the profile.
into the city? The what?
Yeah, so if you are
Oh, I see what you mean.
in the cognitive
Yeah.
city itself, yeah.
Okay. Yeah, I don't have anything there.
Yeah.
Okay, it should be uploaded now. Yeah, there it is.
Perfect. Thank you.
You're welcome. Need to go get my.
You've got plenty of time, so I'll see you when you get back.
Terry. Hey, Jay.
I'm good. How are you doing? Sorry, I was.
Good. It's hard to compete against data visualization. We three may be the only ones here.
I don't think so.
Can you hear me? Maybe not yet. You're auto muted. You might need to unmute.
Oh. Can you hear me now?
I can hear you, Terry.
Okay, yeah.
I just wondered if Jay could hear us.
Oh, she stepped away for a
I
second.
can hear you.
Oh, hi, Jay.
Hi, how are you?
I'm good. Thank you so much for coming. I'm glad you could make it today. It's great to have someone from the West Coast.
I had to get up early. I know, it's ridiculous, but there you have it.
There you have it. Well, we are glad you woke up for us.
I actually went out on a walk too, so I not only just got up, but I also look ugly.
But you're Pacific time awake because of the walk.
Yes,
so
I
we
am.
appreciate it. That's terrific. I think we have a couple more minutes before we have to get started. Did you get to see any of the lightning talks?
Me? No.
Yeah.
I'm
If
only
you get
here
a
for you.
chance, if you get a chance to go back and look at them, look at the one with Dave Malik. It's hilarious. At the front, they have an outtake.
Okay.
It's pretty cute.
Are you still working from home?
Yes. Yeah, I've only been into the office 3 times. And I saw in the news today that they have double digits worth of positive football players right now. So that's its own thing.
Who's surprised about that? Raise your hand.
Yeah, that would not be me.
Are you talking college or professional?
College. Yeah, it was in the news today that Notre Dame had more positive football players. So,
Wow.
but it's to be expected.
Well, yeah, right.
And they are doing very rigorous surveillance testing now.
Oh, that's good.
Of faculty, staff, and students, not just athletes, and not just visitors or incomers to the campus for first time, but ongoingly. So that's changed a lot how we know about our cases and the way we do our contact tracing.
Wow.
Do you have students on campus again?
We do. We have students on campus. We started our semester early and we end at Thanksgiving. And we're largely residential, so they're in the dorms, and a handful of upperclassmen living out in town in apartments, and graduate students primarily in apartments with some in family and graduate student housing.
Yeah, I have kids in college and kids' friends in different colleges throughout the world. And you know, my son's actually been really, really smart about it, but one of his friends at CU Boulder, they say it's really bad there right now. You know, they're spreading it about. Western Washington doesn't seem to be so bad right yet, but you know.
Yeah, that's good. I heard similar things related to CU Boulder. They've had a lot of trouble in Atlanta. UC San Diego thought they had it under control and then it kind of blossomed. We saw the same thing.
Wow.
But we had it tamped down a little bit, but now with this football thing, it says they've got 18 cases right now.
Wow.
So you'll see.
Okay.
Everybody.
We can get started, and then we will just include people as they come in. So I'm going to, so this is, you know, a very simple diagram of the people who are here. And there's actually, one of the things I can do is I can move people out of the way, you know, so we can actually see who's currently in here having this conversation. So, and then I have to mouse over you guys to see your names. Oh, look at that. That doesn't work very well. Okay, so one of the things that we can do in this conversation is first, and you get to see a little bit of the background here. So I'm going to turn on our subject area experience and our methodologies. These are things that we invited people to add to their profiles so that we could start to have this kind of a conversation that Dave was showing us. So so Natalie, most of you got to see earlier in the conversations that we are having, and you know, one of the things that you can see, the different nodes that she's attached to: data stewardship, digital librarianship, observational, Socratic. So one of the things that, if you wouldn't mind doing, first of all, Natalie, is just pick one of these nodes and talk to us a little bit about one of the nodes that isn't attached to anybody else, and just talk a little bit about what that means.
Ooh, okay, that's exciting. I'd like to talk about software preservation.
Ooh.
And my interest in that. I am a member of the Software Preservation Network, and that work is really important to me because one of the things that I'm interested in relative to reproducible research is how important it is for us to share our code alongside our data in order to not only promulgate a culture of open science, but also to help peer reviewers and readers verify the findings they see in published research. And because software is so intertwined with the way we generate our data and analyze our findings, it's important to me that we share our software in responsible ways so others can reproduce our results. One thing that came to my attention when we first started pursuing this was we were sharing files, we were putting code in repositories, we were helping people better document their code for preservation. And a former professor of mine, Cliff Lynch, said to me, don't forget emulation, because sometimes it's more important to preserve the experience of software than it is to preserve the actual binary executable. So I became a member of the EASY project, that stands for Emulation as Service Infrastructure. And I'll share a link to you in the chat about that. And in this project known as EASY, one of the things we allow members to do is to interact with software in an emulation environment, but without having to necessarily have the full stack themselves. Rather, they can pick up recipes for a stack that software might depend on, and then play that software against the stack in an emulation environment that they didn't have to build themselves from scratch. So that's an example of a couple of the organizations that I'm networked to in order to pursue my interest in software preservation.
That's awesome. So, and I know there's probably a couple people in the room right now who could be attached to software preservation or software emulation that aren't. So is there anybody here who fits that
I think I could probably be attached to software emulation.
Yeah.
I worked with a company that put on a program for educational robotics to teach kids how to program. And we were trying to make it more accessible and allow students to basically emulate their program inside of a simulator. So they don't even have to have the robot.
Yeah. So now, and this is perfect. So Josh, I noticed that you don't have any methodologies or subject area connected to your node. So what you can do is you can go up into your profile, and this is for everybody. If there's a node that you feel you should be attached to, feel free to go up into your profile. And if you click on your profile, well, I'm not going to do that right now because it'll take me out of this view. You can actually add methodologies, and you can add subject area, and so that you can start to get a sense of how you're connected to people in the city. Okay, and now Natalie, there are, again, FAIR is one of the ones that connects you to other people in the room. Informatics. So why don't you pick, digital librarianship? Why don't you talk a little bit about digital librarianship? Because I noticed that that also connects you to Jay. And what does that mean in the context of what you talked about in your talk? And then I'm going to give you a couple minutes to just give the cliff notes of your talk, so that we can all be on the same page.
Sure. So I've had a good fortune to work with Jay on quite a handful of digital library projects in the past. Everything from inventories of artwork to images of hospital equipment to law engineering information. And the benefit of thinking through having a digital library, some of you may be familiar with the Association of Computing Machinery's digital library. Think about it as a shared group of assets that everyone can benefit because they're part of or patrons of the shared library. Digital libraries give us greater affordances for accessing things, kind of like we saw in Dave's talk at the opening plenary. When a filter alone is not enough, and knowing a date or an author or even a subject term can't get you to an article, what might? We know that tags alone and subject categorizations alone might not give us the connectedness we need from information that we seek. Digital libraries give us ways to explore and connect information in ways beyond the traditional. They might be geospatial, they might be taxonomic, they might relate to term expansion, synonyms, that sort of thing. They allow us to leverage natural language processing, but also other modalities of analysis like geospatial. So I enjoy digital libraries for that reason, as both a means of preserving research information or assets, but also as a means of accessing them.
Well, that's awesome. There's one of the things that we might notice in these conversations is people will talk about a term such as digital librarianship, and you might have a completely different idea of what that could be versus what somebody else has an idea of that. So just to check in on that a little bit. So Jay, you also share digital librarianship with Natalie. So could you talk a little bit about what that means to you?
Sure. So it's particularly hit home with me in this time of COVID. I mean, I don't know how it is where you are, but we're just staying home, and I am a huge library user. And so a main source of my entertainment and information is cut off because I can't go to the library and look around. In my professional life, metadata application and cataloging is a huge interest of mine because it really that's what makes things available to people. And so I've been looking at the various libraries that I'm a member of to find what I need to keep me entertained and informed during this time. And it really hits home at how more metadata is better. And Natalie mentioned a few things, but one thing that really comes to the fore for me is color. Color is not really a sanctioned, I don't know, field or term or whatever, but in all the catalogs that I've built, I've always put color in because as a librarian, people come in and say, you know, I need that blue book on contracts. You're like, blue? I don't know. Oh, it was updated and now the cover is red. So it's really important to me to put information that people think about in a catalog or a digital repository. And that it also, in a way, doesn't work because if you're looking for an audiobook, for example, you may never know what the cover looks like because you've never seen it. So that puts a different twist on the whole metadata and color application.
Well, you know, as a scientist, I know that there are some pieces of metadata that never go in, like you need to wrap this wire with tinfoil to have this thing work right. You know, like that kind of metadata never shows up, but it never occurred to me around metadata around just the color of a book. That's fascinating, actually. So I've noticed that a couple other people have come into the room. So what I want to do is I want to give Natalie, give you an opportunity to just give the cliff notes of your conversation, okay, and to talk a little bit about the problem as you see it and what you wanted to address in your presentation.
Sure, thanks, Terry. If I might share my screen.
Let's see, do you have,
Let me see if I do.
see if you can share.
Hopefully you're seeing a screen about interdependent, fair, and timely ways to publish findings and share data.
Yep.
The good thing about this talk is that these slides and the talk are available to all of you online to look at your leisure whenever you might have time to get more information about what we'll talk about today. I've pasted a link to the slides into the chat for you. What I'd like to do next is invite you all to go to menti.com and tell me a little bit about how you get your information during COVID. Jay mentioned how during this time of interrupted work and home lives, where many of us have restricted access either because we are off our traditional intranets or because of how we're disconnected from colleagues by working from home, that we may have greater or lesser information availability than we did in the past. We also know that the volume of published literature, social media related to the published literature, and gray literature and preprints make the volume of information about COVID findings really unprecedented. The information I put to you in the chat, if you go to menti.com and use the code 7939284, you can share with me a little bit of information about how you keep up with COVID-19 literature. That'd be really helpful to me in understanding more about how all of us in this session are keeping up with the COVID literature, and help me give you cliff notes that are relevant to what you're using and how what you learned today might give you better ways to access that information. So I'll give you a couple minutes to fill that out.
So this is live right now?
This is live.
Excellent. A lot of us get our information from Twitter, it seems.
Yeah, I know I do. There are certain people I follow and certain organizations I follow so that I can see not only what they're writing and reading, but what they're retweeting about others' findings. That's part of the way that we found out about certain technical dashboard improvements we could make and things like that.
I love these live polls.
I do too. They really help me get a feel for a little bit of what people use to get the information that they're using, but also in this case, I see a handful of you say, here's other. We see 3 of us are getting our information for someplace beside these channels that we see here on the left. If you responded to other, could you unmute and tell us one of those sources?
Slack conversations with coworkers.
Yep.
Secondhand.
Me too, for sure.
New York Times.
New York Times, yeah.
Yeah, I was one of those people, you know, other news sources, you know, that, you know, Wired, the New Yorker, and it'll point to conversations. And then I actually will go to PubMed to look up the articles or to the, or to bioRxiv or medRxiv.
Right, I think the reporting during COVID-19, particularly the reporting related to scientific literature, has been really important in people understanding how early findings influence public perception and decision-making. So now I'd like to share with you a couple other things, and then we can have some more conversation. One of the things I participated in over the summer was the Research Data Alliance COVID-19 recommendations and guidelines on data sharing. I invite all of you to check out those guidelines. You can visit them for free online, and they are available, I hope, at the DOI. I just put it in the chat. I invite you to check them out. They were constructed by over 400 people, divided into a number of working groups according to expertise to address the challenges you see here on this screen. A critical need for rapid data sharing in the time of pandemic, but also an understanding that our rapid, massive research response to the COVID-19 situation created a variety of diverse outputs, and that creates challenges with interoperability between outputted data sets. And that in all this early results sharing, there's a trade-off between timeliness and precision for every early finding that's shared. Another challenge that we saw was a lack of harmonized universal standards and context, particularly between countries and the way we share data with one another, and a kind of lack of pre-approved sharing agreements, and the difficulty of sharing information between organizations and countries where some had very archaic or idiosyncratic information systems. In general, a lack of documentation, context, and appropriate licensing can also challenge reusability. So experts from clinical data sharing, genomics data sharing, epidemiology, and social science came together to author the guidelines that are shared at the DOI to help people within each of those disciplinary areas understand the best repositories and methods for sharing their data so that it could be the most reuseful to others in the community. The other cost-cutting themes that we noticed in our work together were that each of our groups found ourselves having to address the importance of sharing research software and the importance of not only licensing it, but also protecting patient privacy and intellectual property during early data sharing. So cross-cutting teams of attorneys from a variety of countries gathered together to author the section on legal and ethical considerations for data sharing, both to protect survey respondents in-app, to protect mobile phone users' privacy, to protect intellectual property in cases where early findings about particular interventions look promising. And another focus area for the Research Data Alliance were the Indigenous data guidelines and a general response internationally related to the right to results. In other words, if you or your people are being tested, you and your people have to know your results. And what we find is that sometimes those being tested were not having the testing results and the outcomes communicated back to their communities in a timely manner. That might be because the testing was conducted by an employer, or it might be in the United States because the testing was conducted by a county health department and didn't make it back to a sovereign nation community. In Australia, similar situations with Indigenous populations there. So the guidelines are influenced strongly by the CARE principles, which set minimum standards for collectors, users, and stewards of Indigenous data, and strongly encourage you to check out the CARE principles and think about how they might influence the data you share and who you share it with and when. In the community cross-cutting themes, what we saw were ways to encourage public and patient confidence and involvement throughout the data management lifecycle, but also the need to balance timely testing and contact tracing, our emergency response, and concerns for community safety with individual privacy concerns. Use case here is, for example, when a 911 dispatcher sends out a call over the public radio system for emergency responders to visit a household. Do they indicate that that household is COVID positive, and how different communities are handling that? So I encourage you to read the full-length publication and consult it for data sharing that might be appropriate to your community. Another new report that Katie Steen, who you met earlier today, was a big part of, was a convening of the Association of Research Libraries, the American Association of Universities, and the American Public Land Grant Universities to create recommendations for effective data practices based on the National Science Foundation's emphasis on using core PIDs to power findability, and also the necessity of sharing machine actionable and updatable data management plans with your research proposals. So this set of guidelines was just released on Friday. I invite you again to visit it online. You can find it at arl.org and at the DOI that you see on the screen. Let me see if I can share that to you. And I'll paste it into the chat, and then I won't take up too much of your time listening to me, because what you have to say about all of this is just as important as anything I can tell you about it. We learned earlier today about the COVID-19 data set. It's a data set for an open research data set challenge that was mentioned that's being run on Kaggle. It's really interesting to see the challenge questions and the shared code that responds to those questions so that people can keep tackling the COVID-19 data set with code that can be run against it over time. The core data set itself represents how considerable both the volume and the growth of the coronavirus literature has been. When we first applied at Notre Dame for a HPC, COVID-19 HPC Consortium Award to text mine the COVID-19 data set, it had 50,000 articles in the data set. There's now about 200,000. What we found in our project at distantreader.org was that we had trouble scaling to match the size of the data set with some of our values related to making all the outputs of HPC downloadable and reusable by job owners. We really had to rethink the way our reports worked and how stateless our reports could be. That's part of why I really like Exaptive's approach on the COVID cognitive city. And you'll notice when you're on the cognitive city that if you are on the homepage, there's this little search magnifying glass up here. If you type something in it, you're not just searching the cognitive city, you're searching all of COVID-19. So you can see research papers in the context of the rest of the graph. This is a really powerful way to explore COVID-19 in the context of other things that exist in the city. So I encourage you to think of the COVID cognitive city, not just as a way to explore a network of people who might be able to be potential collaborators or have a solution that's helpful to you, which you can do through the Needs Provide network, but also to think about it as a place where you can search, do an Uber search, if you will, against COVID-19 in a simple and effective way. And making those connections is really an important way of keeping research findings flowing back and forth between projects. But if you're like me, you can't even believe you'd need a HPC in the first place to keep up with just reading some scientific articles. When I found out about the COVID-19 literature situation report featured in a couple of the lightning talks by Brandon Guthrie and Jen Ross, I felt like it was a real life ring for me. I subscribe to the report. I read it every day. It's released daily, Monday through Friday, and it helps you keep up. It's free, run by UW, and really a terrific resource. So I encourage you, if you're not a subscriber now, to subscribe. You can do that online, and I'll see if I can show you the link for that in the chat, but I'll do that in a minute. So again, thanks for taking a look at my talk or joining this session. And now I'm going to leave off my screen sharing and hope that we can get a conversation going with the time we've got left to think about how our strategies for coping with both the exponential growth in COVID literature, but also the importance of keeping up with early findings in this early phase of the pandemic are so important to getting it right when it comes to mitigations, cures, and testing.
Thanks, Natalie. I thank you for mentioning the Exaptive, like the cognitive city and the search tool. And I think I'll talk through kind of some of the status of that right now and just be very honest about our challenges and stuff.
Sure, we have challenges too, for sure. I can't even, I sympathize so much.
So we're like a technology company that does a lot of thinking about stuff, as you can see from Dave's presentation and stuff. And when back in March, we just wanted to help. Like we wanted to do something to help, right? And so we put this together, and we have these ideas about the value of the search tool and the way we've built the way we've tried to make the publications fair and building a graph of the publications and in their relation to other things. And we spent a lot of time fixing the core data and importing it. And Josh was part of that, who's on the call now. And I mean, it took a ton of time. And we finally got it in there. And then, lo and behold, like COVID-19 is like, there's like 46,000 documents, I think, in the city right now. And now it's like 265,000 or something ridiculous, And I think we're challenged to kind of bridge the gap between like what we can do technologically with the data and how we get people to use it, and like we didn't really partner with anybody on trying to kind of like help explain the advantage of using and having a tool like this, or to help make the results more meaningful, or to have better context about why the results are more important, or like why some of the results have been surfaced, and it's all left to like smoke and mirrors. And we haven't picked up that project again to try and re-import all of the data or try to kind of re-engage people. And it was very hard to tell whether our initial like engagement with the city is because in the early days of the pandemic, it was like everybody was just trying to search for anything, or whether they were really, really interested in the value that we were talking about having. So I'd love to figure out like how to pick this up and move something forward with it, and hearing you kind of talk about the value, but I don't know exactly what that next project is. And I don't really just want to like willy-nilly say, let's import the 265,000 because, Josh is going to curl up in a ball in the corner or something if we decide to do that without understanding what comes next. So.
This is great. Oh, okay. You're now sharing again, Natalie.
Yeah, I wanted to sympathize with what Tom just said. We had the same problem. So 50,000 we could handle. We were solar indexing everything and then allowing users of the HPC to inform their job input to the text processing out of the solar index, because the size of the corpus was too big for individual human queryers to make sane queries against. So we let them use the solar index to choose which articles in COVID-19 to text process. That still meant if they did the equivalent of select star, they'd get it all. Here you see one of the outputs of our HPC jobs. We affectionately call these job output study carrels. Some of you may remember those horrible little wooden boxes you would sit in college. But what we did, which is just bare bones, was to say where the data came from, how many there were available at that time, how big the subset was that the query generated, and then what we did to that subset, and what the query was against the COVID-19 data set. None of this is enough to truly inform the user about how to recreate the query on their own. Ironically, even though we share a ton of information here, like Tom said, the data set's so big and the metadata is so idiosyncratic that there's got to be some smoke and mirrors to harmonize the data before you can run it through any kind of bona fide NLP. But even with just 327 articles, all in this case related to wastewater surveillance, which is what we're doing at Notre Dame, to get an early feel for what the both viral load is on campus, but also whether it's growing or shrinking, because poop doesn't lie. we've got over 2 million words to come through with our NLP, just with these 320 some articles. If we look at those in terms of just keywords, we can get a little information. If we try and topic model them, more will come out. We begin to get a feel for what's going on there. We might even be able to see questions in the report and get a feel for how the different articles address the topic. And that might help users find the right report, but it's really hard to keep up and surface the right things as the most pertinent and the most timely to help a researcher both answer a question or inform a project. So I sympathize with your situation, Tom, and it's one we encountered ourselves for sure.
Well, I don't know if this would help because of the scale, but one way that I've resolved problems like this is through social metadata application. And what that means is allowing people to apply their own terms. And they're in a user file, so they're not part of the actual record until a taxonomist or a super user or an admin applies them, but you can see how people are thinking about it and you can make them available to other users. So if you have a navigation pane that provides metadata terms, then you can make those available if people have shared them. And no, it's not a panacea, but it can help because not only can you allow more search terms and more people applying terms, but you can see if there's patterns in the way people are thinking about things that the taxonomist may not have thought about. So,
yeah, I appreciate that. One of the tools we use to do that with is called SciGraph. And by intersecting GitHub and other repositories with SciGraph, we can expand against others' terms so that individuals' tags can be connected to formal taxonomies out on others' graphs at Zenodo or GitHub or Open Science Framework or other third-party cloud services. That work is fairly new, but it's promising.
Okay, I'm going to pause the conversation for a second and you guys can all see my screen, yeah?
yeah.
Can you guys hear me? Okay, good. So one of the aspects of this conversation is being able to save these ideas, and that's the idea of the spark. So, you know, Tom, do you want to share a screen to show you creating a spark that has that with this idea here?
So yeah, I mean, I can do that, or do you want me to? I can share my screen.
Yeah, why don't you share, and then just so you can show people what it looks like to create a spark, and this way we can capture these ideas and have them persist.
Give me 1 second to prepare my screen.
And the reason we want to show this to you is so that you could, in the background, start creating your own sparks as well. And I do want to give people an opportunity to create some sparks, because I know there's a couple ideas that I had from your talk, Natalie, that I want to capture because I think it'll be important for later conversations as well.
So I think that the spark, from my perspective, like the spark is like It's really challenging to kind of like describe what that like idea is that I feel like I'm headed towards. But I feel like it's kind of a combination of what Natalie and Jay were talking about, but I don't think I understand enough about what was the word you used or the phrase you used to describe it. It was social metadata application. Is that what?
Social metadata application.
Yeah, and like I feel like I don't understand that, but there's something. I feel like I don't understand it all the way, but I feel like there's something there. And there's also something about like the term expansion and kind of using like we built we built like an ontology or taxonomy of terms as we extract them from the research articles, and then we build a graph out of the relationships between those articles, like the things that we find. But it's just a machine pulling things out using things like TIFA-DIF and stuff like that. There's no like human smarts applied in that system. And I feel like what Natalie's talking about is, well, maybe we don't, like Exaptive doesn't have to make our own taxonomy. Like we use somebody else's taxonomy and leverage that work. And then what Jay is talking about, which I feel like I had a piece of it in my mind for a moment, and then I awoke from a dream, and I can't like get back to what like the social metadata application aspect of that piece is. So, but like this is kind of where I'm thinking, or maybe I'm just making it too complicated. You guys are like, no, just say that, like, like. But the other thing too that I have in here is like the practical limitations of this, and like, we tried once to drive people to the city to kind of tap into this technology and the value that we added on top of the core data, and we didn't get a lot of traction. And so I need to overcome some of that stuff as well and figure that piece too.
And that's actually really good, because that's one of the challenges that there is. And that's not we're not alone in that. So if I were going to direct you, I'd just call it social metadata application. Yeah. And then I would definitely add you and Natalie and Jay. So this is for everybody else while Tom's doing this. You could also add your own sparks, not just from that add a spark node that Tom started with, but you can also do it from the plus in the top right hand corner of your screen. And then, yeah, you can create new keywords around the subject areas or the methodologies.
And so well, I mean, there's the methodologies that we use already are things like TIFA-DIF, and then there's I mean, help me with the methodologies and Terry, and like, to me, like TIFA-DIF is a methodology.
Yeah, that'd be good.
And that's something that we're using now. But is it something that we're going to continue using? Or are we going to use a different system to do the social, like a social metadata application that's going to give us the same thing that TIFA-DIF is doing now? Or is it some kind of like augmentation, or is it not even in the same?
Well, Jay, what might you? Yeah.
I don't know what TIFA-DIF is. I've never used that. I'm not an academic librarian, so sorry, I'm coming from.
Yeah, TIFA-DIF stands for Term Frequency Inverse Document Frequency, which is an algorithm for when you're pulling words out of a document, or like a corpus, like a group of documents or a set of documents. It tells you like how important the word is to the document compared to its importance across the whole set of documents. So you can tell if a word is being used, if a word is being used in every document, then it's probably like not so important to like one specific document, right? But if there's a group of documents in this little corner of the world that is all using the same word, and it's not being used in another area, you can say that the word is more important to those documents than the other ones, and there's probably something special about that word. So, I mean, that's all it is. It's an algorithm to determine how important a word is.
The way I see metadata application is in layers. So the first layer is machine, but that's not the end of the story, because you have to allow humans to interact with the terms on some level. And while a repository of over 200,000 items is huge, every little bit helps. So even if people add terms that may not be in the machine pulled term list, they are adding value to the repository. They are making even one document more findable because they're adding either their interest or their expertise. But they also can use what the machine did to help them. And I mean, in my view, social metadata application, social just means people are contributing to it. And it kind of depends on the user interface. I mean, you have to be able to allow people to do it. So, for example, in this Spark thing, there's nowhere in the methodologies or in some of the where I can choose metadata as a choice. And since I didn't know what TIFF-A-DIF was, I mean, I might have chosen that when I put in my Spark, but I didn't know what that was. So in this case, there's no social metadata application because I can't write something in myself. And that's often that you see that so often in polls or surveys because you're trying to direct the answers. In the case of a repository, I mean, I don't want to direct the answers. I want people to find things. Because if they can't find something, you might as well not spend any time or money on that article or that repository because it's basically lost. The whole point for all of this is people finding things, in my view. So social metadata application, it depends on the user interface and the permissions of the users. So you don't want them to overwrite anything, but you want them to be able to contribute. But if your interface doesn't allow that, then you can't do it.
So I thought of two things while we were talking about that. One, we should probably add network analytics to the methodologies. And the other thing is that, yeah, you can see when you start typing it says create, so we can't actually add new methodologies if there's some that are missing here, just in case anyone's holding on to any.
So one part of Jay's comments that really stuck out to me was kind of around like the layering part of it, where maybe a good starting point is algorithmically pulling out key terms and then using human intelligence on top of that to maybe make taxonomies, add their own terminology on top of it. But what was actually like, I guess I started adding a Spark around, which is like kind of what's the next layer on top of that? And when we look at FAIR, a lot of times like we tend to fixate on the findability, but not necessarily the accessibility. And like I was fascinated, Natalie, around like the software emulation and parts like that, which, you know, given legal agreements and like adoption, is hard to like kind of reach that accessibility. So what I'm curious is like, as we add in layers of like users putting their terminology, can we use that to essentially identify what are the studies that people are focusing on? And maybe those are like the highest priority ones to go about making them accessible on a public level. So I don't know, I was just interested in like kind of looking at those layers and then tying in, you know, the other parts of FAIR.
that's why you want to see the patterns, because something that an article or a series of articles that you don't think are interesting may be really interesting to people who have a new idea or a new course of research. I mean, and one of the layers that I didn't mention is after the machine, I would put in professional taxonomists or something, but you can do it at the same time. You can do the social and the professional at the same time.
I liked Austin's observation about, can we tell through some kind of critical mass what the most important things are to elevate to others' attention? It's really tricky during a public health emergency because the most notorious thing or the most read thing might not be the newest, most effective thing. And it's really hard to promulgate new results in a system that preferences what you might think of as light or reads. So you need a way to show both boosting of newness or novelty, but also boosting of things that are pivot points or difference makers. Sorry, I said that wrong. We saw that in some of the information sharing related to aerosols, and we saw that in some of the information sharing related to positioning of patients with respiratory distress. And simple repositioning of patients made a huge difference in case outcomes. Simply get the person off their back. Another thing that we saw was use of aspirin in early treatment of symptomatic children, and how effective that was in postponing or avoiding other negative outcomes. And there's no way we could make using novelty alone or number of reads alone the importance of giving juvenile patients aspirin be the most read thing by doctors, but that was the most important thing for those cases. So some of the things we've learned about how to text mine or how to rank really confounded by what we might think of as the early phase of a public health emergency. It's challenging some of our commonly held beliefs about how to use text-based information systems in positive ways. So I really appreciate that you brought that up.
Okay, good. So this conversation doesn't necessarily have to end. This is one of the best things about this kind of conversation is it will persist. And you notice that I've added sparks that have started to show up in the city based on these conversations. And I want to give everybody an opportunity now to take a break before the next session. And if there are sparks that you want to add, please feel free to do that. We can do that throughout the rest of the day. And see, the next set of talks will be starting in about 5 minutes. And then that'll be with Kim Black or with John Collins, and you'll join each of those sessions from one of these buttons here. So thank you for being in this conversation and for generating the sparks that got generated, and I look forward to talking to you guys a little bit more on different topics.
Thank you so much, Terry. This has been a blast. I'm going to share to the chat the output of everybody's responses to the Mentimeter question about how you keep up. So here's what we were using before we heard from each other today.
Yeah.
Thanks, everyone.
Thanks.